Hey everybody, welcome back to the channel. It's Dr. Jonathan Pearlman from Paramount Chiropractic and Wellness, and today with Amanda Modeling, we are going to show you what to worry about at a chiropractor and what not to worry about at a chiropractor. So number one, should you worry about your neck being manipulated or adjusted? I would say the answer is no, you should not if you're with an experienced provider who has reassured you that their technique would not compromise structures that you are worried about. Now, if you are with said provider or any provider and you feel something like your head going all the way to the side and then they continued through it, or your head is turned all the way to the side and continued through it, I would say that over time, not only are they not really doing you any good, but it is putting you in that category of where it's becoming something that you should think of as possibly risky. The reason I say it like that is you would very likely have to have a pre-existing cardiovascular issue in your history, and only with that pre-existing condition, when detected through sound, orthopedic, neurologic, and cardiovascular testing, would they know not to do a type of maneuver like that. Now, can you still get adjusted without doing all this rotation in the neck? And the answer is absolutely yes. I have older videos on my channel that talk about if I was to palpate, that means to feel around bones and structures, through the bottom of the neck, and I said that there was a, say like a restriction here, if I was to set up on that restriction and sort of have everyone's head relax and thrust up, when I'm thrusting through the nose, even if the head has some lateral bending or rotational components to it in the setup to get the bone to, the joint to cavitate or the bone to move a little bit, it is really a non-rotary brake style adjustment. Most neck pain comes from C7, C6, C5, as an example. You cannot accomplish influencing the inflammation around the joints by turning someone's neck this way just to get a crack and thrusting that way. That's not taking care of the facet joint at the level, let alone the vacuum phenomenon and the intrathecal pressure associated with annular fibers that are compromised and potentially even disc herniations. So you have to work down in the disc region. Things like traction or decompression could actually be beneficial for some of these patients, but certainly a skilled provider that can manipulate in the vectors that I referred to that are not in the upper cervical using excessive rotation would be a successful way. One of the reasons I wanted to make this video to follow up on the video I made last week was just talking about people understanding that whether it's practitioner doing the work or patient getting the work done to them, that they have to understand like what it is they're trying to accomplish on both ends and how to safely deliver a proper adjustment. So without getting into like a tutorial on where to adjust, that's sort of what to expect and also the way to approach adjusting and getting an adjustment in the cervical spine. Thanks for tuning in, guys.